I still remember sitting across from the fertility consultant, notebook in hand, ready to ask all the right questions, except I didn't know what right even meant. So you know what it's like, right? 1 minute you're full of hope, and the next you're being rushed into a 15-minute appointment, nodding while all the acronyms are thrown at you, like AMH, FSH, IUI, without ever really explaining what's actually happening inside your body. And so what matters the most is that you ask the right questions, and if you don't know what to ask, how can you? So we ask things like, what's my next step, instead of what's the full picture. We ask, do I need IVF, instead of what's causing the imbalance in the first place. And the tragedy here is that by the time that you get the answers to the questions that you need to ask, your body's already been through years of silent shifts. And it's shifts that you could have addressed earlier if someone had explained the real issues with your fertility bandwidth. So fertility bandwidth isn't something that tells you whether you can conceive or not. It's the whole spectrum of your body, because you are a whole person. So it's your hormonal capacity, it's your egg health, it's your emotional resilience. It plays a part, it affects your hormones, your energetic alignment too. And when you don't ask about any one piece of that, then you miss the chance to reclaim it. So there's 3 questions that you need to ask that traditional medicine won't tell you. What's happening with my bandwidth, not just my blood work. So you're not a walking AMH score. Ask about the nervous system, the stress load, and how they affect egg quality. This is the root right down here at this level of why your body might be protecting you from pregnancy right now, because you need all of that energy to stay alive rather than to grow a child. The second question is, what can I do to improve my fertility now, naturally and energetically, before I'm pushed into any kind of treatment at all? Because what's the point in having IVF if the eggs aren't their best quality? If your uterine environment isn't going to support that child when it's put back in. Most programs jump straight into interventions. Mine starts by reconnecting you to your body's natural rhythm and healing potential, because IVF isn't step 1. IVF is the backup plan. And that's what we often miss. We just jump to IVF. Now, the third question, is this clinic or is this program personalising care based on where I am? Or are they putting me just on a conveyor belt? Which very often happens. So you need to dig into that and make sure that it is personal and not being told it's personal, because bandwidth work is personal. There's all of these external factors that are coming into it. So much going on. You can't miss any one piece out, so it has to be personal. So you should be asking, is someone tracking your progress, your whole cycle? Are they supporting your digestion, your sleep, your sex hormones, your trauma responses? Because that's where results shift. Fertility is a reflection of health, not just hormones. And we must stop treating women as broken by default. The body wants to conceive. We just have to listen to the messages. Hormones follow safety. If a woman doesn't feel safe, physically, emotionally, energetically, her body won't open to new life. And traditional clinics, they won't teach you this. They treat you like a set of stats on a spreadsheet between parameters. They offer a protocol, not a partnership, and they don't see your bandwidth because they're only looking at your ovaries, not your whole body. So if you're ready to ask the right questions and take back control of your fertility and your bandwidth, DM me Ask Better, and I'll show you how my program helps women 36 to 48 get clear answers, deeper insight and real momentum naturally. Follow for more truth, because you deserve more than a rushed consult and a pricey procedure that is based on standard parameters. You deserve to feel fertile again.